actually emergency. The response was emergency. And the purpose at that time was actually delivering prevention, care, and treatment services. Generally by U.S. government, coming in really to help in the countries where PEPFAR was at the time. Doing what? Building and strengthening health systems in a way that they should be able to deliver HIV and AIDS services. Unfortunately for Cameroon at that time, PEPFAR wasn't in Cameroon. Slide number 2, please. 2008, 2012, we have what we call PEPFAR 2. For PEPFAR 2, there was a shift from emergency to a sustainable response. Because there was no point testing somebody, putting the person on treatment today, and then tomorrow the person has no treatment. There's no point. So immediate sustainable response was very important at that time. And to be sustainable, it was important to have shared responsibility and country-driven programs. So unlike the U.S. government alone taking all the burden, they started saying it's important for us to be sustainable. We need to partner with host countries and to do what? To scale up core interventions. Those interventions that are actually, saving lives. That's why in the past, I would say, for such a meeting, we should be in Yaoundé. We invite everybody to the ocean and we discuss. But was that actually helping to save lives? No. We are channeling the resources now to core interventions. For instance, making sure that the treatment, prevention from other infections so that children are born without HIV and AIDS, key populations who are actually those key drivers of infection, orphans and vulnerable children, who are generally orphaned by AIDS, so that we can make sure that either they are treated for those who are positive, and those who are negative, we maintain the negative stage. That's when PEPFAR got to Cameroon. We did PEPFAR 2, and actually, PEPFAR started in Cameroon in 2010. And it was implemented by one agency through a research program, and that agency is called CDC. And by CDC, we are referring to Centers for Disease Control. Okay? And by 2011, now all the other U.S. government agencies, by agencies, I'm referring to ministries. All the agencies have to be, stakeholders in the implementation of PEPFAR. And then there was a need now to have an interagency coordinator who oversees everything that all the agencies were doing. And I came on board in 2011 from another position in the embassy as a PEPFAR coordinator. Slide please. And basically more about it. I know when we get to Cameroon PEPFAR, you will know more about the other agencies. And so from 2013 to 2018, that's the PEPFAR. 2011, 2012, when I came in, everybody, even within the U.S. government, the CDC kept the information to themselves. Nobody knew what any other person was doing. Of course, the journalists, they didn't know that there was any initiative in Cameroon such as PEPFAR. Civil society, they were not aware. And PEPFAR is a changing organization. With PEPFAR 3 now, they say it's important not only to be sustainable, not only to emphasize on sustainability, but also to emphasize on shared responsibility. Because something that is given free is highly appreciated. But if you partner, no matter how little you bring on the table, then you take it a bit more seriously. It was also important to improve on the quality of services that are provided to address HIV and AIDS. Transparency, accountability for impact is very important. You have asked, what is PEPFAR doing? What are the achievements? I'm going to share with you how much Cameroon has received so far and what has been done. And of course, I just hope we want to hear from you whatever recommendations you have for us all to work together towards an AIDS generation. And within PEPFAR 3, the focus actually accelerates core interventions, those PNCCT, ARC, key population for OBT, you know, those interventions that can actually help reduce infection and save lives. And as I said, PEPFAR started in Cameroon within PEPFAR 2 and PEPFAR 3. Like, so this is globally, actually. For those who want data, this is globally, and I can share this with you. You know, if you want, I can share this with you. You don't need to copy. I can, you know, forward if I have all your emails, I can send it to you because I know that data is very important, and I'm going to talk more about that. So a lot has actually been achieved thanks to this initiative, this reference initiative. This is actually the largest bilateral investment in Cameroon from US government. And the impact is visible. That's the reason why, in a physically declining environment, this is the only initiative that Congress is moving forward. And for Cameroon, while other countries are declining physically, we are improving. And I'm going to talk about that. Slide please. As I said, the strategic efficiency, delivering an AIDS-free generation, and by that what we mean is focusing our program to control the epidemic by doing what? Doing the right thing, in the right way, at the right time, and by that I'm addressing the last expectation which we received, where I can't remember, Chief said HIV response is actually focusing only in cities and not in communities. Now, in the past, we were just working. But now, whatever intervention we want to carry should be informed by science and data. We don't go to a place where we are not going to meet people. We only go to places where we are going to meet those in need of care, those in need of treatment, those in need of testing, and where we test and find problems. So it is very important to know that if somebody is sick, we don't want to wait to say, okay, you need to do all the tests to get the person on treatment. Making sure that the person gets the appropriate treatment at the right time. So this is the catchphrase that you keep hearing me saying, doing the right thing, in the right place, at the right time. Right, please. So, when we talk about the right thing, this is what in PEPFAR language we refer to as core activities. And by core activities, we are referring to those activities that actually have the highest impact on HIV and AIDS generation. And by this, we are referring to PNCCT. It's all pregnant women actually who are positive. They do their test, and those who are positive are placed on treatment. And after delivery, the children are followed up with EID, early infant diagnosis, and the children, those who are positive, they are placed on treatment. I think that's the way forward. That's something that is very important, and I'm glad it came from you. You wanted to know more about PNCCT. ARC is about treatment. There's no point sending somebody to go and do the test, and when the person is positive, then there's no treatment. And I want to tell you, PEPFAR has done a lot in Cameroon. That's why, compared to 3 years ago when we had a lot of stock out ARV, I'm sure since January, has anybody heard about stock out? No. It's now history. The language is history. And it's thanks to PEPFAR through the emergency commodity fund. And of course, working in partnership with the whole government and with the global fund. So that is condom, of course. And in some other countries, we're talking about voluntary non-circumcision. It's not an issue in Cameroon because the rate of transmission is very low. So we are not focusing on that in Cameroon. Prevention, which is effective and targeted, which means we don't need to go to places where, or touch people where they are not infected. there was a study that was carried out because people would imagine that university students, you know, you go there, it's surveillance of the high. No, that's just thinking. Whatever decision we are making should be based on science and data. Those neglected and hard to reach populations. There are some populations that actually, for instance, prisoners. It's very difficult to reach them when they are suffering in silence. Our role is actually to follow the disease and get to that level where the disease is addressed. It is the only way we can reach an AIDS-free generation. Pediatrics. Currently, how many people are infected? About how many? What's the estimate of people infected in Cameroon? Who have an idea? Any idea? We have over 600 people. And how many of them are actually on treatment? As of December 2016, 131. So you can see the level, the gap. And amongst that, how many children? 5,600 children only. So there's a huge gap in children. And that's why children pediatrics is very important. And I'm going to talk to you about what PEPFAR is doing, which is another central initiative to double the number of children who are on treatment in Cameroon. From that 5,600 to 11,200 in 2 years. Adolescent young girls. You'll find out that adolescent young girls, I'm going to talk a little bit more about that when I get to PEPFAR Cameroon. So, those key populations, men who have sex with men and sex workers. You know, our law does not, allow, it's punishable. Those activities are punishable by law. So what is happening? They hide themselves, they keep themselves, and they are talking. Then at the same time, are transmitting. Right? Because most of the NSMs are also married for people. Their partners at home don't know, their spouses don't know that they have that relationship. And so we need to find out ways we can actually reach them, because if we don't, they remain key drivers of the infection. Health system, whatever we do, if the nurses don't know how to receive you amicably, with love and affection, it won't work. Whatever we do, if they cannot make notes to provide good data, we cannot plan well. We cannot, we cannot identify gaps and address gaps. If the drugs get to Cameroon and they are stopped here at the port or in Yaoundé and they don't get to the treatment center, they expire. So the supply chain, very important. If data is not there, it's a problem. If you go to the lab and you are positive and they test you and they give you a result and you are negative, it's not helpful. If you are negative and they tell you you are positive, and so lab strengthening is very important. That's why health system strengthening is very, very important to support all these activities. Slide, please. This is what I was just saying. So CORE, unlike in the past when PEPFAR was just carrying out those, activities, PEPFAR decided to classify activities that we carry in different 3 major areas. CORE is what has a direct impact on life. Those are the critical activities that save lives and prevent new infections. Of course, grounded in science, based on data. Those are the activities that we must do. We can't play with them. Near core activities is what we can do, but these are also activities that can help us to support our goals, but other people like the Global Fund, UNAIDS, or the whole government is doing. So in the past, there was duplication of efforts. You see, the journalists you are here today with PEPFAR, tomorrow, UNAIDS will be here with you. The next day, UNICEF will be here. The next day, NAC will be here, doing the same thing. We are wasting resources. And so, those activities that others can do, we cluster them and we say, these are near core activities. And for us to move on with that, we need to consult with the other stakeholders and agree on who has to do that. Both government or the other partners. Non-core or nice to do, these are activities that really didn't have any direct impact on HIV and AIDS, either saving life or preventing new infection. But, there were these activities, overhead, management and operations, they were taking a lot of our resources, but they were not helping Cameroon. They were not helping any country in the world. And what is happening is, as of last year in June, drastically, all non-core activities in all PEPFAR countries shut out. And that's why some people ask for changes. What are the changes in Cameroon? A lot has changed from last year to this year. I'm going to tell you more. And in this process, we want to make sure everybody is involved. Instead of the journalists asking a question, I'm coming to you to tell you what is happening, to have your expectations, for us to begin a dialogue, and to see how together we can be able to partner towards our next generation in Cameroon. I'm here to share data with you on our resources, in line with our transparency agenda. You need to know you are the eyes in the city. If anything is happening, you need to know the whistle, because together is the only way we can reach our next generation in Cameroon. Likely. So summarily, this is what we are saying. We need to ensure that we are all doing the right thing. And by the right thing, we are looking at those core interventions. Core interventions mean the things that will actually save lives and prevent new infections. We want to ensure that we are going to the right places. That's where the epidemic is. We are not just hanging around, but we're going to where those who are affected, who need our services are. And we are reaching those hard-to-reach populations, and we are providing the services that they need at the right time instead of waiting. We are hoping that the WHO guidelines will be implemented in Cameroon. Because if we manage our resources well, we should be able to implement the guidelines, and that's the only way we can now move towards an AIDS-free generation in Cameroon. Community level, I'd like you to see the last point, because to address again the emphasis in the past, our focus was actually facilities, HIV and AIDS facilities, going to the hospital. No, those people who are providing care to those who are infected, it's important. And those people who feel that they have to be discriminated against because they are infected, no, this is at the community. So interventions at the level of the community, a strong component of the HIV and AIDS response in Cameroon. Not only for us, then of course for all the other stakeholders like this. So for moving forward, globally, PEPFAR has these three pillars: accountability, transparency, and impact. And I'm going to talk more about that. Slide please. By accountability, we want to be cost-effective in our programming and maximize the impact of every PEPFAR dollar investment. We want to make sure that we are transparent. We share data with you. You are aware of whatever resources we have and what are we doing with it. And together we can partner to do what to create impact in Cameroon by sustaining the control, the epidemic control. Not just for now and then next year things get worse, but making sure that they're actually saving lives and reducing the new infection. Likely. I don't know if anyone ever heard of the blueprint for an AIDS-free generation? So this is a document, this is what we will see this document. This document was released on World AIDS Day 2013. And the goal of this document was actually to move forward those three guiding principles: transparency, accountability, and impact. And as I said, the impact agenda within the blueprint is to control the epidemic. Efficiency agenda is to save lives through smart investment. Sustainability agenda is to ensure that we have shared responsibility and to really monitor the progress we are making. Partnership agenda is to make sure we are all working in partnership with all the key stakeholders towards an AIDS-free generation, and of course, human rights agenda, securing, protecting human rights. Like this. This is now the details. I have already talked about impact agenda, which is controlling the epidemic. But if you see in the brief, it's actually efficient and effective control of HIV epidemic. I've talked about the key of core intervention already. And one thing which I like to, highlight here is monitoring. In the past, what were we doing? We sit and we read reports, but I want to tell you now, all the US government staff responsible, all the agencies, we monitor from the site. Where is PEPFAR dollar spent? In which community and in which hospital? How are the services provided? Is it quality? Are those hard-to-reach populations accessing these services? We do that on a monthly basis, and we share the data. And where there are gaps, we try to improve. Please, slide. Efficiency, as I said, we want to make sure we save lives through smart investment. Increasing transparency, oversight, accountability, with all the PEPFAR resources that we have. And so something new that came up in October 2014, this is the second year we are doing it, is called expenditure analysis. We in Cameroon, all the money we receive or resources, we have to account for all the PEPFAR dollars, which is a change. You would notice that people were coming along in the store, you don't see them any longer, because the cost you're using for that transport at the end of the year, when we do the analysis, you have to account for that. Slightly, sustainability agenda, as I said, country out. Black community said, I want partnership. That's why I'm here. We want to work together to ensure that together we can have a shared vision and all contribute towards an AIDS-free generation. We want to ensure how do we improve governance, especially in the health sector. We know the things that are happening in the hospital. We know the things that are happening in G-Santé. How can we together improve on that? How can we improve on the human resources? How can we improve on the financing? Abuja Declaration. We are still at one of the lowest countries now, 6% instead of 15%. How can we ensure that the government is actually allocating the required amount of help so that help should get on the radar as a priority for the government? Transitioning over to local services. That should be our program and not the US government program. You are on the ground, you are with the population, you are talking, we should be part of the PEPFAR program. Slide please. And so, what I'm saying again, this is all globally. This is what is expected from all PEPFAR programs globally. Because we need to have this global vision, and then we can focus on Cameroon. And so, now we have the need to forge these relationships now with civil society organizations, with journalists, with multilaterals, with bilaterals, with faith-based, and in Cameroon, still very timid private sector. Because the private sector is there, they also have a role to play. Slightly human rights agenda, we just talked about that, ensuring that people are protected. People have access to services that they need. Slightly. In 2015, when I say CAP is country operational plan, in 2014, something just came on us imposed. After developing our country operational plan, they said, Cameroon, 58% of your budget for that year should be spent on care and treatment. Forget about every other thing that you're doing and get 58% of your budget and care and treatment. That was for Cameroon. And this was, The same for other countries, but different percentages. So the least country have to put 50% of their budget on care and treatment. And that was imposed from the US Congress. If you didn't plan in that line, you didn't get the results. So for